Hello, my name is Angela DeRolf, and I'm your Perry County Health Commissioner working at the Perry County Health Department. And today I want to talk to you about the Ohio Public Health Advisory System and Perry County's COVID-19 Risk Level 2 status. The Ohio Public Health Advisory System provides a clear, easy to understand, color-coded approach to inform you about your current risk associated with COVID-19 and provides evidence-based recommendations and actions that you can take to protect yourself and your community based on our level of risk. When looking at the data that feeds into the Ohio Public Health Advisory System, there are 10 key indicators across 5 data categories which will be used to assess our community's COVID-19 risk. Broadly, the 5 data categories are COVID-19 cases, sentinel indicators such as COVID-19 symptoms reported at emergency departments, hospitalizations, contact tracing, and testing. These key indicators will be analyzed daily by the state's comprehensive monitoring team to look for changes. The current plan is that the data is compiled by the state's comprehensive monitoring team on Wednesdays and then will be released on Thursdays. However, this process may change as we move forward. So this system is comprised of 4 risk levels. So as you see here, level 1, which is yellow, is active exposure and spread. And this happens when 0 to 1 indicator has been triggered. Level 2, which is orange, and that's where Perry County currently is, means increased exposure and spread. Exercise a high degree of caution. And that means 2 to 3 indicators have been triggered for Perry County. Level 3, which is red, that is very high exposure and spread. Limit activities as much as possible, and this occurs when 4 to 5 indicators have been triggered. And the last level, level 4, which is purple, is severe exposure and spread. Only leave home for supplies and services, and this happens when 6 to 7 indicators have been triggered. So on Thursday, July 9th, the updated Ohio Public Health Advisory System was released, and Perry County increased from a COVID-19 risk level 1 to a COVID risk level 2. So this means that there is increased exposure and spread, and that you should exercise a high degree of caution. This happened because the data that the state's comprehensive monitoring team had been analyzing showed that Perry County triggered 2 of the data indicators. So Perry County saw an increase of the proportion of cases not within congregate settings. So a congregate setting is usually defined as a long-term care facility or a prison. So since this increase did not happen in a congregate setting, this is an indicator that there is a greater risk of community spread within Perry County. Perry County also saw a sustained increase in outpatient visits. So this indicator showed an increase of the number of people visiting outpatient settings with suspected and confirmed COVID-19. So today I wanted to share with you Perry County's trend data. These trends are based on the date of illness onset. So when you look at the data, you can see that we had been holding pretty steady. So each blue line indicates a case. So this is again the illness onset date, except for April 1st, where we actually had 3 cases that reported April 1st as the illness onset date. But then if you look here towards the end of June, early July, you can see that we have seen an increase in cases, and we've had them happen more frequently. So because of all of this, Perry County has now been upgraded to a risk level 2. This means that we need to continue to comply with the health orders that are currently in effect, and we should follow the evidence-based guidance and recommendations for action for each risk level. So that includes level 1 and level 2. So under level 1, we need to conduct daily health symptoms and do self-evaluations. So monitor ourselves for temperatures and symptoms, and if we are showing symptoms, we need to stay home and or contact our healthcare provider for guidance. We need to continue to maintain social distancing of at least 6 feet from non-household members. We need to wear face coverings in public, especially when social distancing is difficult to maintain. We need to increase caution with when we're interacting with others who are not practicing social distancing or not wearing face coverings. And we need to avoid traveling to these high-risk areas. The nice thing about this advisory system is you can see every county in the state of Ohio, you can see what level of risk they are at, and you can also look at the recommendations that are provided so you know what to do if you're traveling in those counties. And of course, we need to follow good hygiene standards. We need to continue to wash our hands frequently with soap and water for at least 20 seconds. We need to use hand sanitizer frequently. We need to avoid touching our face. We need to make sure we cover our cough and sneeze with a tissue, throw the tissue away, and wash our hands. But now that we're under a level 2, we also need to follow level 2 guidance. So we need to avoid contact with anyone who is considered high risk. Those folks that are high risk, they should take extra care and follow precautions. This is the time that we need to decrease in-person interactions outside of our household, and if we need medical care, we need to seek it when necessary. So if you would like to continue to follow the data and monitor the Ohio Public Health Advisory System, what you need to do is visit coronavirus.ohio.gov, and it takes you to a page that looks like this at the top. And if you go to the far corner, you will find the Ohio Public Health Advisory System. If you click on that page, it will take you to a page that looks like this. And so you can see the entire map for the state of Ohio. They also have other resources on that page, like the risk level guidance that I've talked to you about today. They're also working on county profiles. So at some point, Perry County will have a link that you can click on with more specific data. So I know the state is in the process of working on that. So please continue to watch coronavirus.ohio.gov, and please continue to practice the evidence-based guidance and recommendations that I have shared with you today. We need to make sure that we take appropriate actions now to try to lower our level of risk and make sure that we don't go to the red COVID-19 level 3 risk category. I ask that you make safe choices, not only to protect yourself, but to protect others within our community. And remember, we are all in this together, and we are Perry County Strong. Thank you.